And I can't tell you the number of times I have talked to hospitals and then a year later I run into somebody from there and she'll say, ever since you were here, we started this thing where we started giving people omega-3 fatty acids. We started taking them outside and doing a walk. They take their babies and they go for a walk. And they said their depression rates have just gone through the floor. When you start thinking, gosh, there's nothing I can do about this massive problem, I want you to look at this in a different way. There are things you can do. If you think about what they did, it was a very simple thing, but it was very powerful. Hey everyone, welcome back. This is the Science Chick Report, and I'm Dr. Kathleen Kendall-Tackett. And I'm continuing on a series of short podcasts that I want to talk about different things that can be done at a community level. Can you talk to moms about possibly doing some of these things? And can they help with depression? Okay, so let's say, you're in a community group, you might be a single practitioner, and you're wondering, oh my gosh, I've got all these moms that are having trouble with depression, and what can I do? They won't go to see a doctor, or they can't afford a doctor. What can I do? And I want to say that there is actually a lot you can do, okay? And you can talk to mothers about, mothers could do themselves, or you can actually even start a program together where you get together and you talk about things, and you can really make a big difference. I think the thing that's important is to know what other resources are available in your community, especially for more serious cases. You want to make sure you're not trying to go it alone, okay? But, I have certainly run into this group of mothers over the years, mothers who they don't want to do the classic psychiatric thing, going on medications, doing therapy. They just don't, for whatever reason, and it could be, they're in an ethnic minority group who just does not trust healthcare providers. Okay. It could be a cost thing. It could be an embarrassment thing. It could be a job thing that they're worried that somehow their employers are going to get wind of this, which unfortunately does happen. Healthcare information does leak. That's a realistic concern. So it's kind of like you think, oh, is there nothing we can do? And I'm saying, no, there is a lot. I've actually been teaching classes about alternative treatments for depression for a long time because I think it's an important area. I think it's important to note that, mothers or anybody who's depressed actually has options besides just pills and psychotherapy. Now, pills and psychotherapy can be great in certain situations. But again, if you have a mom who's very resistant to those, you don't want to just say, okay, oh, well, I guess we can't do anything, because then she's still quite depressed, and that's going to have an effect on her. It's going to have an effect on her baby. And so that's really not a satisfactory kind of outcome. So what we want to do is we want to make sure that mothers are, taken care of, but also things that are reasonable and that are affordable. Okay, so this last one I want to talk about in terms of this type of option is exercise. And you might think, oh my gosh, what are you talking about exercise? Are you talking about physical fitness? No, not really. I know everybody kind of gets a little bit fanatic about this. And sometimes when people push exercise, they push crazy amounts of exercise. If any of you have ever watched the show The Biggest Loser, and they were making people faint, they were making people vomit. I mean, that's an insane amount of exercise and really not necessary. In fact, overdoing like that actually can increase depression because it increases inflammation. But what they have actually discovered is that a moderate amount of exercise actually has a huge effect, not only in terms of physical health, but also mental health as well. Okay. And it actually, surprisingly, has been used to treat even major depression. Okay. So again, it is a very, very, very effective treatment. Okay. But, the problem is, and let's talk about this problem up front, oftentimes if a mother is depressed, it's honestly the last thing she feels like doing. She just does not want to do this. But again, convincing her that, hey, you have the tools available pretty easily. And this is something maybe that can be done as a group activity. It's funny because it's like when I go out and speak to hospitals, when I talk to them about, okay, so you got this hospital, but, again, you have a bunch of people who are noticing this problem, but the hospital administration won't pay any attention. And what can you do? And I can't tell you the number of times I have talked to hospitals and then a year later I run into somebody from there and she'll say, ever since you were here, we started this thing where we started giving people omega-3 fatty acids. we started taking them outside and doing a walk. They take their babies and they go for a walk. And they said their depression rates have just gone through the floor. So when you start thinking, gosh, there's nothing I can do about this massive problem, I want you to look at this in a different way. There are things you can do. And, if you think about what they did, it was a very simple thing, but it was very powerful. So you got omega-3s, good, excellent. I would also add probably vitamin C to that. But then you're getting them outside. So they're getting some vitamin D, but they're also getting some exposure to bright light. Also good. Okay. That's also a very helpful thing. So they're getting exposure to bright light. They're getting some exercise. They're getting omega-3s and they're getting some social support. And what is the net cost of that? Not very much. It might be a staff person's time, say, taking a walk around the park with a group of moms. Maybe they keep doing it on their own. Maybe we get them started and they keep doing it on their own. So these are things that show you that there's a lot of power and there's a lot more alternatives than just, okay, we're going to, get them going, on medication, possibly psychotherapy. Back when I first started working in this area, they immediately told mothers to wean. I still think a lot of, mothers are told that, but I think it's less common than it was. But I want to say, hey, guys, there's another way. There's another way to do this. Okay. So exercise, very good. So, James Blumenthal, actually, at his colleagues at the Duke University Medical School, actually did two studies. The first author of the first one was Babbia, and the second one was Blumenthal. And it was the same design, one done as a trial, one done as a larger study. So what they did is they got older adults, aged 50 to 80, with major depression, okay? And they put them in randomized clinical trials, Zoloft head-to-head with exercise, okay? And everybody was like, that will never work. That will never work. Well, it did work, okay? So at 4 months, this is what they found, okay? So looking at all the different conditions, they found, first of all, looking at what they call efficacy. So the treatment was effective. So for the medications, for Zoloft, it was about 47% effective. Okay, so remember, this idea that you give people a pill and they get better automatically is not true all the time. Okay, but 47% was the highest. Okay, but followed by exercise at 45%. So head to head, that's just not that much different. That's really pretty close. So that was the supervised exercise program, 40% for the home program, and 31% for the placebo. Okay, so again, particularly supervised exercise seems to be effective. And I think part of the reason is because people do it. But I also think there's a social support, component to that as well. People are expecting you. They want you to be there. They notice when you're gone, versus, it's very easy to kind of sink into your own hole, your own dark hole. When you're depressed and you're home and you're by yourself, versus people expect you to show up. Okay, so more recently, there was this systematic review by Marconison, and that was in 2021. And they said that exercise had a significant effect. They looked at 5 meta-analyses of it. Okay, and they found that out of 2,419 subjects, participants, that included that there was a small effect size, but when they took out overlapping cases in the meta-analysis, it went up to a moderate. So remember, moderate effect size is really quite good on these things. It's very unusual to ever get a large effect size on anything. Okay, so a moderate effect size is strong. Okay, so looking at this compilation of all these different studies, this is what they found. Another review of 52 studies, which include 131,000 patients, found that exercise reduced prenatal depression. And this was by Davenport. Okay, so kind of, is this safe for mothers to do? The answer is yeah, because it doesn't have to be super strenuous, and there's been a number of studies looking at exercise in pregnancy and preventing prenatal depression. And preventing prenatal depression is a great idea because if you can prevent prenatal depression, you actually lower the risk of preterm birth. Okay, so that's actually one thing that's really important. And then postpartum, it's also good. Now, people have kind of raised the issue. Yeah, but if you exercise, you're going to get lactic acid buildup in the milk. Okay, well, I think the problem is when you talk about really strenuous exercise, that potentially can be a problem. Okay, but with moderate exercise, which is what we're talking about here, moderate exercise actually is good for people, and it actually can lead to less lactic acid. Okay, so you get a little bit, but it doesn't seem to be a problem with the babies. The only study I found specifically looking at this was an older study. So it was back from 1999. It was at the University of New Hampshire, and they looked at milk samples and find, that there might be a little bit of an increase in lactic acid in the milk, but it didn't seem to bother the babies and didn't seem to cause any health problems. So, in other words, we don't have to worry about it. Strenuous exercise, on the other hand, it's kind of an interesting thing with exercise because, when you first start, okay, you obviously increase inflammation. Anybody who's ever kind of started an exercise regimen and they haven't been at it for a while know that for the first few days, you're going to be sore, really sore, and so, yeah, that's an indication that there's inflammation going on in your muscle. Okay. And so that contributes to those systemic inflammatory factors. Okay. So that's a problem. But then what happens is you keep doing it more and the inflammation goes way down. Okay. But if you do something like, say, for example, marathon running, and particularly people who do, marathon back to back to back, you find that those inflammation levels go way up. Okay. So again, it used to be that kind of the idea was you would, to train somebody to do a marathon, that this was kind of the pinnacle, and they've kind of backed off of that because they've kind of found, yeah, actually that seems to be sort of counterproductive. Now I know people who absolutely love running marathons and they think it's great fun. I'd say, hey, do whatever you want. I don't think that that's terrible, but I don't think we should be encouraging everybody to do that because there does look like there is some downside to it. Okay, so one of the other issues that kind of comes up is the original studies looked only at aerobic exercise. Okay, so a lot of the studies were like things like walking on a treadmill. Okay, so then I've had people ask, well, what about other kinds of things? What about yoga? What about strength training? What about Pilates? Those are not quite as straightforward. Yes, it does look like those definitely have an effect, and those are certainly exercise. Okay, but oftentimes, the ones that seem to be the most effective are the ones that have an aerobic component. So if you combine, say, aerobic with some kind of strength training, or yoga or Pilates, something like that, then that actually does seem to be helpful. And you can do that during pregnancy. You can also do that postpartum. And part of the thing is, in the original studies, you're talking about older adults. So it was easy to kind of get away for a block of time. Okay. But it's harder with the baby. So, again, think about this. How can you talk to mothers about this so it's doable? So maybe starting off with some short walks. Maybe they try to do a couple of things during the day, that add up to, say, 30 minutes. And what kind of some studies recommend is 150 minutes of exercise a week. I'm not sure how realistic that is, but that could be something to kind of shoot for. But it can be broken up. And so, what are some small things people can do, like bit by bit, plus some of these group activities that actually could be really helpful, especially, the weather's nice. Everybody kind of gets out, they get a little walk in, they see each other, they kind of have some fun, they get some sunshine. All of this is good. It's all good. Okay. But again, it can be very inexpensive. We tend to think of things like, oh, yeah, but how are they supposed to afford a gym? Well, you don't necessarily have to be in a gym. There's all kinds of places, walking trails. There's a program that for Black women where they get them together and they go walking around their neighborhoods, and it's been great. It's called Girl Trek. And it's like they go around neighborhoods and stuff. And it's been transformative for a lot of the women in that. Because as they're walking, they start noticing, wow, there's some problems with this building, or maybe there's something going on here, or, and so then all of a sudden it increases their community involvement as well. So a lot of sort of side benefits. But so exercise in general is really good. Okay, so again, they said they kind of recommend 150 minutes. The Babiak program and stuff talked about, 30 to 45 minutes at least 3 times a week. Okay, so that can be harder to do if you've got a baby. But again, thinking about can they incorporate their baby into that, put the baby in the stroller, put the baby in a pack and walk around the neighborhood a bit, or if that's not safe, walk around a shopping mall, walk around a high school track. There's lots of different ways if you start thinking about it. And, I think one of the things that you can do is kind of help brainstorm about that. How could you do that? I think exercise is one of those things that's appealing to people as a treatment for depression, but you kind of want to make sure they're doing it. Because one of the things that depression causes, obviously, is inertia. You don't really feel like doing it, and it's very hard, and especially if it's in the middle of the winter. And so kind of think about, okay, if we've got this, talk to moms realistically about, okay, so how would you do this? where would you go? What could you do? What things do you need in place to make sure that this happens? Okay, so you need a stroller or you need a baby carrier. Okay, or you need somebody to watch your child for 20 minutes. Are there any gyms in your neighborhood that have childcare? Or if they don't want to leave their baby, which is understandable, can you take your baby and go do something? So kind of thinking about how to do it. But I think also too, there needs to be with this one particular, some accountability. And this is what I say, I really recommend that it's like if somebody wants to try some of these alternative treatments, that we have some follow up. Okay. So even if we're at the community level, say, okay, listen, there are some things you can do that without going full into the sort of medical way to do it. But I want to make sure that they're actually helping. So would you be willing to come back in 4 weeks or 6 weeks and let's test you again and see where you are? See if there's any kind of improvement. Remember, most antidepressants take a long time to work. But the nice thing about exercise is the effects are almost immediate. You start, doing some exercise and you immediately feel better. And that can be something too. And I think one of the things also that's important about exercise is it can break isolation, depending on where they do it. Now, they may choose to do it at home, but honestly, there may be some real benefit in getting out and going to someplace else and doing it. Go explore your neighborhood or, go to the shopping mall or go to your high school. If there's a gym in your neighborhood that's reasonably priced. I mean, there's a lot of gyms that are. So these are things to kind of explore. And you as, kind of the touch point, person with this, you might consider exploring what are some options that mothers have, in these situations and say, well, if you want to try this, here are some places you could do it. Just like, let's say you live in a neighborhood where it's really not kind of safe to go out walking, particularly with the baby. So, okay, so what are some safe alternatives and how could you do it? How could you get there? So these are some things that kind of can be effective. And so with that, I would say, this is another thing that we know that is super effective for mothers, especially when combining it with things like omega-3s, combine it with vitamin D, combine it with light. We haven't really talked about light, but light can be a big thing. They did some studies in Finland, which of course is dark a good chunk of the year. They had people exercise first thing in the morning on treadmills in front of light boxes. So like, let's say you live in an area where it's dark a lot of the year, how could you do something like light therapy, if you can't really get it from sunlight outside? The good news is light boxes are now available on Amazon for very, very reasonable. When I first bought a light box, I think my first one was $150. They're way less than that now. They're probably 15 to 20. You can buy something, so if you think that that's something you notice, you're more sensitive, and in the winter, you just really feel blah, or, you've had your baby, it's the middle of the winter and it's just nasty. Okay, what kinds of things can you do that are exercise where you can actually also get some exposures to light? And light is something first thing in the morning seems to be most effective. So, like say when you're doing your morning chores, turn on your light box. When you're getting your breakfast, have your light box on. Instead of just imagining that you're going to sit in front of something for 30 minutes, say have it in your kitchen. So as you're getting breakfast, as you're maybe feeding the rest of your family, you can actually, flip on your light box. Okay, so you want one that's pretty bright. Okay, so, there've been some debate and some studies about how bright is too bright. You want something that's about 10,000 lux. So when you're shopping around on Amazon, and if you're running a program, perhaps you can even have a couple of light boxes that are available. So when your moms get together, in the middle of the winter, you can flip on some light. There's really no harm. The only people that are potentially harmed by bright light would be if they have some undiagnosed bipolar. You can actually trigger mania, but that is a really very rare risk. For the most part, people feel better when they're around some light. So early morning, first thing, they're kind of sitting there, they got light. Maybe they're in a discussion group, or they're doing some exercise together around a gym or something, and you've got it really lit up. These are things that can help. So again, really, there's a lot to do, and as I said, at the beginning of this, I've worked in the nonprofit segment my entire career. I have seen what groups can do, practically with nothing but two nickels to rub together. So don't be discouraged just because somebody's not willing to step in and fund it. And, honestly, sometimes if you can demonstrate that, hey, this has actually been really helpful, can we scale this and make it available to everybody? Depending on where you work, you might find other people that are interested in helping you with some seed money to actually increase it. So these are some things to kind of just think about. I'm going to actually post some handouts that I have for mothers on some of these alternative treatments. So you can take a look and kind of see some of the references. Unfortunately, a lot of the stuff, people who have kind of moved away to different topics, but I still think it's relevant. And this idea of especially exercise and exercise combined with some of these other things. I said the only one of these alternative treatments that we've talked about is you don't want to start combining with things that St. John's wort. Okay, but all these others can be combined and they can actually really be quite effective. But we want to make sure that they're actually being effective and working, and we want to have some like kind of follow up. And I think honestly that's a problem and a mistake that a lot of healthcare providers make is they treat something and they don't follow up to see if it's actually worked. So, in your, whatever capacity that you see new moms and you're concerned about, let's be kind of transparent. Say, look, we want to do this, but we want to follow up and make sure that this is actually working. And if it's not, let's try something else. Perhaps we can add something else to this regimen. As I said, maybe they're just doing vitamin D and exercise. Okay, so would omega-3s help with this? Possibly. And you know what? There's no harm in them. They're actually going to be good for you. So all of these things can be kind of tried. And I think part of it is just having discussions and saying, hey, look, we care about you. We want you to get better. We want this to be easier for you, and just, I think just the fact that you've got somebody who cares, I think right there is very healing. But you also have some tools that have a lot of evidence behind them that can actually be implemented for little to no money and really can make a huge difference. Okay, so in the next segment, I'm going to talk about some of the community kinds of programs that can be. Now, these are, again, when you start talking about things on a little bit larger scale, but these are things that can be kind of done by an individual, but an individual, what I do recommend always is, you make sure you find out what kinds of things are available in your community, should you need assistance with a more serious case. If you've got a mother that you're very, very concerned about, you've got a mother who's maybe tells you she hasn't slept in, 2 or 3 days, something like that. That's very concerning. So we want to make sure that, whatever we do safely. And that we also too are very, very clear about where are the lines of our scope of practice. Recommend that mothers talk about this with their healthcare providers. We're not prescribing. We can give them the information and they can kind of make a decision, hopefully in conjunction with healthcare providers, but, they might decide to do it on their own. Okay. But, we've got to be careful. We don't kind of cross some lines because that can be another problem. Anyway, so with that, I'm going to kind of wrap up. In the next part, I'm going to do a several part series talking about some community interventions. So for now, thanks for listening. I'm hoping you find this helpful. Send me a note, write to me, let me know, have things worked for you? What kinds of things worked? What kinds of things didn't? And let's have a conversation about it. Perhaps we can brainstorm. I was impressed at some of the hospitals along the line have done things that have been pretty amazing. They've, started these programs where they're doing something pretty simple. They're getting the moms together, out walking, they're taking omega-3s, and the mothers are getting better. Something very, very, very simple can really sometimes make a huge difference. And they were thrilled because they felt like they could actually do something in the face of this. Because I think that's kind of the horrible thing, to see something and you can't change it. And to see something that was wrong and you can't change, that can be, I think, a very hard thing. So now you have some tools and you can actually have, ways you can kind of point your energy toward this. Okay, so thanks again for listening. And until next time, thank you.